An important delivery arrived last week. The first COVID-19 vaccine shipment came to Central Illinois to healthcare workers. And there are still a lot of questions surrounding the vaccine, including who should get it. Today's CI Health sponsor is Carle. They're here to share a little more insight. And Dr. Sally Salmons with Carle, the Carle Associate Chief Medical Officer in Medicine and Medical Subspecialties, is with us now. Thank you for being with us.
Thank you for having me.
Well, this is exciting times now that the vaccine has arrived. So let's just dive right in and talk who should receive this COVID-19 vaccine.
Yes, so Carle encourages everyone to get the COVID-19 vaccines as soon as it becomes available. The CDC currently recommends it for those 16 and over. We must continue to be diligent about fighting the spread, though, as we wait. But anyone over age 16 is strongly encouraged to become vaccinated.
And I hear that obviously doses are limited. So let's talk a little bit about who's going to be able to get it right now.
Yeah, so, because supplies are limited at first, but we expect that those are going to be expanding in the near future and hopeful for that. State health officials developed a phased approach that we are following for distributing to healthcare workers first, especially frontline workers, and to long-term care facilities. And we'll be expanding from there following the state guidelines. It'll take a little bit for the vaccine to arrive. As you know, some of that's has been received already. But as soon as it becomes available, we have plans in place to help get everyone vaccinated.
You know, there's a lot of controversy surrounding the vaccine. Will they get it? Will they not? How do you feel? Are you going to be getting that first dose?
Yes, in the phased approach, because we want to make sure those that are frontline get it first. And I'm only occasionally frontline, but I'll be the first to roll my sleeve up when it's my turn.
You know, they've had this whole big Operation Warp Speed with how quickly they have rolled this vaccine out. Are you confident it's safe?
Yes. As a physician and, our profession's based in science, and researchers have been very careful at the approach, and the approach is not exactly a new one with the mRNA virus. It's one that was investigated for some other things and rolled out and dusted off. And the rapid pace reflects the importance of the work in our country and the significant resources directed to address the demand. So it was a full court press to get this to the forefront because of the importance, and also very confident that safety precautions were followed and appropriate investigations have been done. So really confident in the safety of the vaccine.
Yeah, and it's nice to know that there are two options now with Moderna and Pfizer both having vaccine options. However, I think a lot of people may be concerned about some side effects. So should we be concerned about what may happen after getting the vaccine?
So, a lot of vaccines have very mild side effects, and we don't expect the side effect profile for the vaccines to be significantly greater than other vaccines. People might get a little bit of a headache, they might get a little bit of muscle pain, and those are just signs that the vaccine is working. And we encourage people to, plan for a day of rest after they've been vaccinated.
Now, let's say somebody has already had COVID. Do they still need to get vaccinated?
Yes, and the current recommendations are roughly 90 days after either receiving COVID antibody treatment or actually having COVID, which folks that are getting antibody treatment do have COVID, that folks wait about 90 days.
Okay,
following,
we talked a little earlier about how the vaccines arrived and how it's going to be phased out. So when can the general public, expect to be able to get this vaccine? We're talking 16 and up, right?
Yes, and the Pfizer vaccine has been approved for those 16 and up, and the Moderna vaccine is for 18 and up. So want to make sure that people are aware there's just a little bit of a difference in the age approval for the two vaccines. And general public wise, it will be dependent on vaccine supply, obviously. My personal prediction is, sometime in late January, early February, hopeful that it's sooner. I think that we can really be hopeful that vaccination for the general public is on the way.
Well, yeah, I know a lot of people have been looking forward to the day that the vaccine has arrived. Others still may be a little bit concerned if they want to learn more information and educate themselves on if it's a right fit for them. What's the best way for them to do that?
Yes. So, Carle has a COVID-19 website that folks can check for good information. Also, CDC has a great website, and the Illinois Department of Public Health. So all reliable resources to get accurate and up-to-date information.
All right. Well, we appreciate the work you all are doing there at Carle to help ensure everybody is safe and well, especially during a pandemic. And we'll be happy to connect everyone to what's happening at Carle after today's show at CI Living.TV. Dr. Salmons, thank you so much.